Colorectal cancer usually begins as a small benign clump of cells called polyps that form on the inside of the colon. Over 10 of these polyps can become cancerous. The biggest risk factor for developing polyps is being over 50 years old. Over 50% of people over 50 have precancerous polyps. Larger the polyp becomes, the bigger the risk of it developing into cancer. Polyps may be small and produce few if any symptoms at first. However, polyps gradually enlarge and may eventually penetrate the bowel wall. When they spread, it is usually to the liver, lungs, and brain. If symptoms develop, it may cause one or more of these three main symptoms. 1. A change in bowel habits that last for more than a few days.
Diarrhea is most often seen and can either be a secretory process, the tumor is leaking fluid, or from partial obstruction and overflow around the tumor. Constipation is also seen and is due to increasing bowel obstruction. 2. Blood in the stool. Blood in the stool can show up in a variety of ways, and what the blood looks like can give clues to what's going on in your body. An adult's digestive system, including the esophagus, stomach, and intestines, can be as long as 30 feet, and the blood in your stool can come from any part of it. A good description of the appearance and amount of blood can help your doctor identify the problem. If there is only blood on the tissue when you wipe, but not on your stool, this is more likely to be hemorrhoids. Hemorrhoids are swollen veins that can easily get damaged when you pass a stool, causing a little bleeding. This blood will be bright, which means that the blood is fresh and the bleeding is coming from lower in the colon. If polyps are located low in the rectum and start bleeding, you may see bright red blood similar to hemorrhoids. Slowly bleeding polyps at the beginning of the colon may result in dark red or black stools. As a general rule, the longer blood travels in the gastrointestinal tract, the darker it tends to present in the stool. This is why people with ulcers often have black tarry stools and cramping or abdominal pain. Patients often complain of the constant urge to have a bowel movement, and the feeling is not relieved by having one. This could indicate that a tumor is preventing a complete bowel evacuation. The presence of a tumor might also create a false feeling of stool remaining even if the bowel is empty. Thankfully, this is a slow-moving process. It's estimated that it takes about 10 years for polyps to take a cancerous turn. This gives us a chance to stay a step ahead of colorectal cancer and brings us to the importance of early detection to identify polyps before they turn into cancer. One way to test for colorectal cancer is to look for hidden blood in the stool. The idea behind this type of test is that blood vessels in larger colorectal polyps are often fragile and easily damaged by the passage of a stool. The damaged vessels usually bleed into the colon, but only rarely is there enough bleeding for blood to be seen on the stool by the naked eye. You use a special spoon to collect a stool sample and should store it in the container that comes with the test kit. This container is then returned to your doctor. Another way to test for colorectal cancer is to do a visual exam. For this test, the doctor looks at the entire length of the colon and rectum with a colonoscope, a flexible tube about the width of a finger, with a light and small video camera on the end of it. It's inserted through the anus and into the rectum and colon. Special instruments can be passed through the colonoscope to biopsy or remove any suspicious-looking areas such as polyps if needed. The stool-based tests are typically done at home, so many people find them easier than tests like a colonoscopy. But these tests need to be done every year, and if the result from one of these stool tests is abnormal, you will still need a colonoscopy to determine whether you have cancer. Colonoscopies can be done less often than stool-based tests, about once in 5 to 10 years, but they are more invasive and require more preparation ahead of time. If the cancer is diagnosed at a localized stage, the survival rate is 90%. If the cancer has spread to the regional lymph nodes, the 5-year survival rate is 70%. If colon cancer has spread to distant parts of the body, the 5-year survival rate is only 12%. Thank you for watching this video. Please watch my next video if you want to know how people die from cancer or how to recognize the symptoms of a dying person.